Thank you for that warm introduction. Respected Rector Sir, Deans, distinguished dignitaries sitting in the front and second rows, and especially our vibrant future healthcare professionals. Namaste to you all. It is truly an honor to be here. As I stand here today, I don't just see a sea of students. I remember once I was there, sharing the same dreams and also maybe wearing the same anxieties that you're wearing now. When we speak to the medical students, we usually talk about clinical guidelines, technical skills, and evidence based practice. But today, I'm going to talk about something that textbooks do not usually teach. It does not require a stethoscope or a prescription pad or practice protocols, but it's going to shape your future. So I'm going to talk about trust. Let me begin with a simple question. What kind of healthcare professional would you like to be in the future? I'm not asking what fancy degree you're going to pursue or what specialty you're going to choose. I want to ask you, what kind of soul will be standing behind that white coat? Have you ever thought about it? In recent years, we've all witnessed something deeply unsettling incidents where healthcare professionals are shouted at, accused of neglect, and even assaulted. Hospitals, the places where healing should be there, are turning into the spaces of hatred and chaos. Our immediate reaction? We ask for stricter laws, more cameras, and strong security. Yes, we deserve to be secure. We deserve our safety. But let us pause for a moment, reflect, and ponder. Think of the people we trust the most: our parents, our families, and our closest friends. Would we ever harm them? We may get angry, we may argue, we may have differences, but harm? No, never. But why do we hear so many stories where healthcare professionals are harmed? Violence is not the beginning of a story, it's the explosive end of a long, silent struggle, fear, and helplessness. I'm not saying that violence is acceptable. What I'm trying to say is violence could be the painful symptom of the trust that has been breached. There was a time when a single medical officer looked after the whole village or even an entire district. Yet the trust in that doctor was unshakable. They were not just healthcare providers, they were deeply rooted in the community. They were involved in the community's joys, in its fears, and also in the collective well being. All because of that connection. They were treated like saints, like gods. Now imagine a different scenario. A family stands in a crowded corridor of a very busy hospital. Their loved one is slipping away. No one takes time to explain them properly what's happening. No one, no one meets their eyes. In that moment, the white coat no longer represents hope. The white coat becomes a symbol of distance, the symbol of power without connection. That's where the trust begins to fracture. Building that trust is not always easy, but sometimes the biggest barrier for that trust is not in the system, it's within ourselves, it's our ego. I remember as a young medical officer, I was very frustrated when a patient or their relative called me sister instead of a doctor. I had worked so hard for that title. I wanted it recognized. But over time, now I've realized that I was so focused on my status that I failed to see the bigger picture. Sister in our culture is not demotion, it is the title of closeness. It's someone who stays, who listens, who cares for you. My frustration had built a barrier of authority. Instead, I should have built a bridge of connection with the patients. They were not stripping me of my title. What they were trying to tell was, we are scared, we are helpless. Would you please give me a helping hand? At 3 a.m., no mother cares about our title or our status or our GPA scores. He only looks at our eyes and asks for reassurance, asks for honesty, asks for humanity. When I was a junior resident, I remember a surgeon, very senior surgeon, brilliant, precise. Once he saved a young boy, after a devastating accident. The surgery, a masterpiece. After the surgery was over, he carefully described the procedure to the father. The father listened, and at the end, you know what he asked the surgeon? Doctor, did you put the symbol of Shiva that I gave you before starting the surgery? The surgeon focused on patient safety, sterilization protocol, and steps of surgery. So he told it was not possible because of the safety issues and sterilization problem. The father just nodded and walked away. As a resident, I could see the pain in the eyes of the father. Now, I often wonder, what if the conversation had been different? What if the surgeon had acknowledged the faith of the father? What before the surgery he had explained the father about the risk and found a small way to honor the faith safely. The surgery, excellently successful, but trust and connection broken. Because what I believe is healing is not only biological, it's emotional, it's cultural, and it's also deeply human. This is why I believe we must go beyond the WHO official 5-star doctor concept and strive to become 7-star healers. So let me explain. The first star, ethics, integrity, that remains unshakable even when no one is watching you. Communication. Explain, repeat, confirm that you are clear. Many medical errors occur because of communication errors. Professionalism. Maintaining that grace and kindness even after 24-hour on duty. The fourth star, empathy. I'm not asking you to cry with every patient. You'll be dehydrated by noon. I simply ask, try to wear their shoes. The fifth star, leadership and teamwork. Respecting the ward boy as much as the consultant, because no healer works alone. Sixth star, humility. Having the courage to say, I do not know, and wisdom to seek for help. And the seventh star, lifelong learning. Keeping your heart and your mind as open as your textbooks. These are the 7 pillars of trust. Trust follows a simple equation. When people feel heard, their anxiety decreases. When they feel understood, their anger softens. And when they feel cared for, trust begins. And trust me, trust is the most powerful medicine that we can ever have. It absorbs frustration, it softens grief, and it transforms conflict into conversations. So I ask you once again, what kind of healthcare professional or what kind of healer do you want to become? The world does not need more brilliant minds that are always in a hurry. The world needs bigger hearts who have the power to build that trust. I'm sure your degree will make you very powerful. Your knowledge will make you competent. But your ability to build that trust, to remain humble, and to show compassion is what that will make you a true healer. And trust me, when the wall that has been built for your safety, when trust is built, that wall has no meaning at all. And will you ever need that wall if you can build that trust? Thank you.